First oral question, Lord Alton of Liverpool.
I beg leave to ask the question standing in my name on the order paper.
I apologise to your Lordship's House, and I'm grateful to the Chief Whip, my noble friend, as ever. My Lords, in 2023 to 24, 8.7 million identified patients were prescribed antidepressants at a cost of £220 million. This compares to 2015-16, when it was £270 million for 6.88 million people. The NHS Business Services Authority report patient prescribing data on an annual basis rather than a running total. All licensed antidepressants meet robust standards of safety, quality and efficacy, constantly reviewed by the MHRA.
My Lords, can I thank the Noble Baroness Lady Merrin both for her reply now, but also for facilitating and attending our meeting with the Medicine and Healthcare Regulatory Authority. Has the Noble Baroness had the chance to read the correspondence which I've shared with her from the bereaved family of Thomas Kingston, who, like Olivia Russell, committed suicide while using antidepressants, and has she noted that the coroner intends to issue a prevention of future death report to the MHRA? In the light of this and this tragedy, what can the Minister do to create a more rigorous approval regime, including greater definition of risk? And given that hundreds of millions of these drugs are issued at a cost of hundreds of millions of pounds, can the government establish a longer-term inquiry to ask searching questions about root causes, what's leading to endless repeat prescriptions and driving such widespread reliance on antidepressants?
Well, let me start by extending my deepest sympathies to the family of Thomas Kingston in the light of his very tragic death earlier this year. And we will await the findings of the inquest and act on any recommendations by the coroner as appropriate. Whilst there has been an increase in prescribing, as the Noble Lord observes, I would make the point that antidepressants, for example, are often prescribed for a wide range of reasons, not just for the treatment of depression, but also for migraine, chronic pain, and ME, amongst others. So there is a very wide range, and the other reasons that it could have increased is because there is less stigma, I'm pleased to say, in respect of seeking mental health treatment. But I would say to the Noble Lord, it is never the first port of call. It is one of the tools in the box to assist people. There are no current plans to conduct a review as he requests.
My Lords, Noble Lord Alton did not mention whether we are talking about specific antidepressants, but I think the case he referred to does refer to a group of antidepressants called selective serotonin reactivation inhibitors that treat the patient by increasing serotonin levels. But they do run a risk of patients having suicidal ideation, a feeling of wanting to commit suicide. In the meta-analysis carried out using 29 reports of research, it was found that they're beneficial in early phase of treatment of depression. But in later phases, the data is less reliable. Hence, the question is whether MHRA and NIHR working together look at the evidence that is available and produce the appropriate guidance, because one of the important things to avoid higher risk of suicide using this group of drug is to have a proper monitoring, which means proper controlled visits to appropriate health specialists.
Well, I can assure the Noble Lord that NICE does keep all its clinical guidance under active surveillance to ensure it can respond to any new evidence that's relevant, including relevant clinically related literature that could possibly impact on its recommendations. And more broadly, I'd say to the Noble Lord that guidance does recommend that suicidal ideation should be monitored in people with depression receiving treatment, and particularly in the early weeks of treatment, and that does include specific recommendations on medication for people at risk of suicide.
My Lords, a study in My Lords, a study in 2019 found that a third of women were prescribed antidepressants by their GP to combat symptoms of the menopause. What is the government's current assessment of this situation and adherence to NICE guidance in this area? And if the Minister doesn't have full details to hand, perhaps she could write to me.
I would be very pleased to write further to the Noble Lady. It is a very important point about support for women in the menopause. However, what I would say to the Noble Lady is that prescription is only made after discussion with the patient as well as other alternatives, and the clinician has to be following the guidelines in order to comply, and I would also say patient choice is absolutely key here. So it is a case of every individual is an individual, and what is appropriate should be prescribed if needed.
The Minister has pointed out, SSRIs can be the right choice for some patients, but in order for there to be patient choice, there has to be capacity for those therapeutic options. But in April 2024, around 1 million people were recorded as waiting for mental health services, 340,000 were children, and over 100,000 had waited for more than a year. The government has pledged to provide an additional 8,500 mental health staff. Can the Minister say what she will do to increase patient choice and build that capacity?
We have already made a number of commitments, but the Noble Lady is quite right to observe the excessive numbers on the waiting list, and we are deeply aware of the distress and continuing difficulty that causes for many. Lord Darcy, in his independent investigation, confirmed that about 1 million people are waiting for mental health support as of April 2024. And as we move to the 10-year plan, that will be a whole opportunity to put mental health services in a different place. In addition to the commitments that the Noble Lady has mentioned, we are also providing access to a specialist mental health professional in every school, and providing open access young future hubs.
My Lords, I am grateful to the Noble Lord Alton for organising a meeting recently with the Noble Lady, the Minister, the MHRA and some psychiatrists who raised the issue of SSRIs and the side effects. Now, one of the concerns raised was that patients need to be aware that one side effect of SSRIs is to have suicidal thoughts. So I was surprised to look at the NHS website and its page on side effects of antidepressants that you have to scroll down 4 or 5 pages before you see the warning signs about suicidal thoughts. So while we await the review from the MHRA, which they discuss with us, can the government and the NHS look at the advice on the NHS website so that those who prescribe SSRIs are clearer about the risk of suicidal thoughts?
Yes, indeed, I'll be happy to look at that. However, it is the case that there have been warnings on the leaflets within medication for some 20 years. It's always a cause to review to make sure it's more effective. And I'd say there's at least 2 sides to this. One is the clinician doing their job to discuss side effects, including at withdrawal from the medication. But it's also important that patients understand it as well.
Is my noble friend the Minister aware of the work of the Charney-Warner Memorial Trust, who's directed to provide awareness among teachers, tutors and so forth of the danger of suicide and the work that they perform?
I'm not specifically aware of the point that my noble friend raises, but I'll be glad to look into it.
My Lords, I want to raise the issue of dependency on antidepressants. As the Noble Lady, the Minister, will know, there's an awful lot of people who have great difficulty coming off these antidepressants. And it is striking that for those using drugs illegally or substance abuse, that there are many services. There are no services in the NHS for those seeking to withdraw from antidepressants, and this is a major problem. So with that in mind, can I ask 2 questions? Firstly, will the government give consideration to the the delivery of a helpline, which has been called for in a number of reviews on this, so that people can have some access to help? And secondly, will they support an NHS project which is designed to introduce withdrawal services within the NHS?
It is an important point that the Noble Lord makes about the effects of withdrawal from any medication, indeed. I'm not sure this is an exact answer, but there is, of course, the 111 helpline, which has been expanded to refer to mental health services so people can ring and ask those questions. But I do take his point about withdrawal, and I would, that may be something that we would wish to consider as we go towards the 10-year plan.
Second oral question, Lord Addington.
My Lords, I beg leave to ask the question standing in my name in the order paper and remind the House of my declared interests.
My Lords, the majority of children and young people with special educational needs have their needs met in mainstream schools, and we're committed to ensuring that schools have the resources and expertise to identify needs earlier and support all pupils to succeed. We're working with experts, parents and carers to strengthen accountability and ensure inclusivity through reforms to Ofsted inspection frameworks, increasing workforce expertise through evidence-based training, and encouraging schools to set up resourced provision or SEN units to increase capacity to better support children and young people in mainstream settings.
I thank the Minister for that answer, but remind her that it is estimated that 70% of dyslexics are not identified at school. The figure is also very high for things like those with high-functioning autism. Is the government going to make sure there is a coherent pattern of training so ordinary teachers refer to those with expertise to identify? Because if you don't identify, you stand no chance of giving the different learning patterns that are required.
The Noble Lord is absolutely right about the need to identify early, and we do have measures in place to help teachers with early identification and support, and particularly for the teaching of reading, including the phonics screening check and statutory assessments in Key Stage 1 and 2, the English Hubs programme, the reading framework, an updated list of high-quality phonics programmes for schools, training for up to 7,000 early years special educational needs coordinators, and the Partnerships for Inclusion of Neurodiversity in Schools programme, which will upskill primary schools to support neurodiverse children.
I am the great aunt of Ollie. He's I suppose my great nephew, and he at the state school, brilliant, Liberty at Merton, can't speak highly enough of them, and they had no trouble identifying he had a problem. The problem was the assessment and the length of time waiting for that. So in the end, I coughed up and paid for it, and he's now in a state school with a treetops with a special unit, and he's cooking and he's thriving. I had my first birthday card that I could read every word this year. So can I ask the Noble Baroness, the Minister, how many children are waiting for assessments? What's the reason for the long waits? And what are we going to do about it?
Ollie is very lucky to have the Noble Lady as his great aunt, and but she raises an important point about the speed with which it is possible to carry out assessments, and it's for that reason that we are supporting local authority educational psychology services by investing over £20 million to train 400 more educational psychologists, because they play a particularly important role in supporting local authority educational psychology services and contributing to statutory assessments. And we must, as the Noble Lady says, ensure that more children are able to succeed in our mainstream schools, as I'm sure Ollie will.
My Lords, 1 in 20 people in the UK are estimated to have dyscalculia, yet it frequently goes undiagnosed and then therefore without the support that would enable these young people to overcome the challenges in processing and dealing with numbers. Currently, there's no requirement for maths teachers to learn about dyscalculia, dyscalculia, and even special needs teachers aren't always trained to recognise and deal with it. So will government consider introducing a statutory requirement for maths teachers to learn about dyscalculia in initial teacher training, and can she confirm that these specific challenges will be addressed through the curriculum and assessment review?
Well, the Noble Lady does make an important point about the responsibility of all teachers to be able to identify special educational needs. All teachers are special educational needs teachers, and that's why, whilst I cannot be completely clear about the point about dyscalculia, I can assure the Noble Lady that we are supporting improved teacher training through teachers' careers, starting with initial changes to initial teacher training coming in from September 2025, and then going through teachers' careers as early career teachers and then into their leadership roles. But I will perhaps follow up the particular point that she makes in her question.
As my honourable friend the Minister knows, there are hundreds of thousands of children who simply do not go to school. How do we measure the limitations that they're facing in the educational sphere?
My noble friend is right, either through persistent absenteeism, where we do, for example, see a higher proportion of students with special educational needs, or those who have been completely removed from schools and are no longer on school registers. So it's important both that we tackle absenteeism in the way in which this government has outlined, and I've talked about on previous occasions at this dispatch box, and also that we introduce, as we intend to do through legislation, the registers for those children who are not in school, so that we can ensure that they, well, first of all, that we can make our schools appropriately inclusive, so that parents don't feel the need to remove their children, and children don't absent themselves from schools because of their inability to be able to learn, but so that we can also track children when they aren't in school.
My Lords, despite significant progress in the identification of pupils with SEND in recent years, some groups remain significantly underrepresented in accessing a formal diagnosis and acquiring an EHCP. Looked after children, as well as those experiencing the most severe poverty, and those who belong to Romani Gypsy, Traveller and Roma communities, face particularly serious barriers. May I ask the Noble Baroness, the Minister, what steps the government will take to ensure that the most vulnerable children with SEND are better served?
The Right Reverend Prelate is exactly right, that where you see a assessment of special educational needs alongside other areas of disadvantage, there is, if you like, an additional concern and an additional difficulty for those children to succeed. And that's why we need to make our schools more inclusive. We need to make sure that we have the specialist workforce in place, some of which I've talked about today. We need to make sure that the investment is available for those higher needs in local authorities. And we need to make sure that we are intervening earlier. And for example, as more children are able to get early years education alongside the trained support that we are providing in early years education, I hope to be able that we will be able to identify those children earlier and start them off at least on a better chance of succeeding in our schools.
My Lords, last week ministers and the Department for Education rightly noted on social media the very poor results for children with special educational needs in the recent SATs tests at the end of primary school. But in the same week, there was a spooky silence from the department and its ministers when the analysis of the 2023 trends in international maths and science were published. My Lords, our Year 9 students are now 5th in the world in maths and 6th in science, beaten only by the East Asian countries. There was no word that I could find of acknowledgement to celebrate the success of English students from a single minister in the department on social media. So I wonder if I could invite the minister to take this opportunity to congratulate our students, thank our teachers, and acknowledge that the Conservative education reforms had a massive impact.
I was around in 1999 when the focus of the last Labour government was on literacy and numeracy in a way which has undoubtedly led to continued improvements in our children's literacy and numeracy, and I am more than happy to thank and give credit to the teachers and the students who have performed so well in English and Maths international assessments. But a level of complacency, which I'm sure I couldn't accuse the noble lady of, but it is not right for us to feel that our job is done when we have a special educational needs and disability system which has been widely described by the NAO and others, including members of the Noble Ladies Party, as a lose-lose situation for our children and a failure to enable all children to be able to benefit from the excellent teaching that I am more than happy to praise.
Third oral question, Lord Rooker.